Welcome to Myo360, the podcast, where we'll delve into all topics related to myofunctional therapy, including airway health, snoring, TMJ, tongue ties, thumb sucking, and even bedwetting. As a myofunctional therapist and a formal dental hygienist, I am sharing stories and tips to help you identify if myofunctional therapy is right for you and how it works to improve your overall health. Join us while we explore the ever-growing world of myofunctional therapy. We have one goal in mind: to help you and your family live your best life. Welcome back to Myo360. I am your host, Becca Rose. So if you'll recall in our last episode, we talked about what to expect and what it was like when you come into the office to have your full myofunctional therapy assessment. To recap on that, that's the assessment that we do before you would start myofunctional therapy. And the purpose of that is to go through all of the different muscular functions and movements that we assess during the evaluation. These assessments help us to determine what works well, what doesn't work well, and then what the next steps are, honestly, because sometimes myofunctional therapy is not the first step. So we do that assessment to figure out where you are, what your goals are, what your needs are, and what's going to be the best first step for you. All right, so today I'd like to talk more about what is a myofunctional therapy program like in its entirety, and what does each session look like? So that's a big answer. That's a big thing to discuss because it's not just an easy answer. And the reason it's not an easy answer is because in this office, there is no cookie cutter programs. So sometimes you'll visit or talk to a myofunctional therapist and you don't get specific answers to your questions. That should be a red flag to you that, okay, maybe this practice is doing cookie cutter therapy, and we don't ever want to do cookie cutter therapy because it doesn't work for everybody. All right. What a cookie cutter is a good guideline. It's a good maybe starting point for some people, but it should never be the same exercises in the same order for the same people, whether you're 5 or 95, it doesn't matter. There should never, ever be cookie cutter. So this is a hard question to answer because the answer is that when you come here, your story and your therapy and your situation is going to be completely different than the person I just saw last hour. So it's going to depend a lot on the age of the child, the abilities of the patient, what they're coming for in the first place. But let's go through a gist, like let's give you the gist of it, right? So you have your evaluation. And then you're like, yep, this is the right thing for me. And then we go forward with a myofunctional therapy program. The first thing you have to do is be committed. If you are not committed to the process of doing the therapy, it's not going to be successful for you. Just like any kind of therapy or any kind of anything you're trying to do, if you don't have the volition to do it, or you don't have the commitment to do it, it's not going to work for you. Okay. You're not going to get out of it. So that's probably the very, very first thing that has to happen when you decide, yep, this is the right thing for me. This is the thing I've been looking for. This is the missing link to all the things I've tried or all the different providers I've seen. You have to be ready. Now, when I say that, I don't want it to sound scary because one thing I will say is that this is a long process. So myofunctional therapy is not a quick fix. It is not fast. Typically, depending on the client, the age, and all the other variables I've already talked about, I might see you once a week, every 2 weeks. Sometimes I see people once a month or every 3 months. It really is highly dependent on the situation. But the process is long. What's nice though is that the activities that we discuss and the exercises I give you to take home are not so long. So typically we might be looking at 5 or 6 minutes twice a day of activities that we will go over. And then I will ask you to continue practicing those at home until we have your next schedule visit. Typically with children, if I'm looking at a 4 or 5, sometimes a 6 or 7 year old, we might meet a little bit less frequent. We might meet every 3 or 4 weeks because it's going to take that child a little bit more time to be able to implement the exercises and get them correct. And I'm not so nitpicky, like it's got to be perfect or we're not going to move on. But we want to have good quality of the exercise. We don't want to just rush through to get it done. So I will recommend that you do your exercises for a certain number of repetitions or a certain amount of time per day. I don't want people to just rush through. Okay, I got to do this for a minute, or I have to do this for 2 minutes. So I'm just going to get it done really quick. Quality is important. Quality is more important than quantity. So yeah, I want you to be able to do those maneuvers in a good and controlled way because as we're learning how to do more things with our muscles, we have to be in control. If we're scattered and crazy and we're not in control of that, it's not going to give us much benefit on the back end, right? That makes sense, right? So quality versus quantity, that's the first thing. The second thing is we talked a little bit about the time of therapy. So, depending on what the goals are, we could be doing therapy for 6 months, 7 months, maybe a year. But this does not mean that I'm seeing you every single week for a year. We might go through periods of time where I see you every week for a couple months, and then we bump up to every 2 weeks, and then we see you once a month. So it really is variable. There really is a high variation of situations, okay? And you are not going to be the same as the next person. So I really want that to be the main takeaway from this process with my office, that it's not cookie cutter. You can't depend on, all right, we're going to see you every week for 3 months and then you're going to be done. It does not work that way. All right. At least it doesn't work long term in your benefit that way. So, all right, why does it take so long? That's probably the biggest question I get. Once we like answer the questions on like, how does this work and how much does it cost? And we go through all the somatics, then the next question is, why does this take so long? This is my interpretation, right, of why it takes so long. You have been doing muscle movements and performing functions incorrectly for your entire life. Now, this function could be your swallow, it could be the way you chew, it could be the way you breathe, or the reason why you snore. So, there's some sort of muscle dysfunction in the oral facial area that has led you to me in the first place. Then we have to understand that those muscles have been doing their job incorrectly your whole life. So we have to disrupt that. We have to disorganize it. We have to shake things up so that your muscles are confused in a good way. So if your muscles are used to swallowing a certain way and chewing a certain way, and then we come in and we say, hey, no, you're going to do this differently now, it confuses the body. It confuses the muscles and the nerves in the brain, and that's a good thing. We confuse those muscles by asking them to do movements and sequences that they're not used to doing. These are not hard things, okay? But we have to get things moving in a different way than we're used to so that we can start to undo the way you've always done it so that you can learn how to redo it in the correct way. And that is really what we're trying to do. Now, the disorganization part, that takes a couple months because we're not just disorganizing the muscles, we're also starting to add movement. We are starting to add tone. We are starting to add coordination and endurance. And we're working on swallow functions. And then we're going to eventually add resistance and strength to the bigger muscles in the face. So it is a process, but the good thing about it is that this therapy process is considered neuromuscular. This is neuromuscular re-education. What the heck does that mean, Becca? That's a big word. So neuromuscular re-education means after we disorganize and we disrupt all your old muscular patterns that are causing dysfunction, then we learn new patterns, and those are patterns that your muscles are able to create a new neuromuscular memory to. So you literally are creating new neurological pathways to your muscles so that they start to function correctly every single time you swallow. Okay. And then you do this automatically and you don't have to think about it anymore. When we're first learning this, yeah, we have to think about it. We have to, we have to think about the 2 or 3 or 4 steps that happen when you try to do a correct swallow. We have to think about it because we don't know how to do it. But then as you continue to do it, and we have different tools and different things we use to help your body figure out how to do it, once you learn how to do it, it becomes a habit. It becomes a new neuromuscular connection. And then you habituate that or you integrate it into the way you live every day, and it becomes your new normal. And there's 4 main goals of myofunctional therapy. The biggest end goal is a correct oral phase swallow. And once you integrate and habituate that oral phase swallow, you are continuing to do therapy pretty much forever because you swallow thousands and thousands of times a day. We've talked about this in other episodes. So once you habituate that correct swallow and you do it automatically, you learn it during the day, and then you start to swallow your saliva correctly at night. And then that tongue stays up on the roof of the mouth, and it helps to keep your airway open. It's not falling into your throat. And your tongue is helping to support the whole structure of your face so that your bones stay where they're supposed to, and there's less likelihood for teeth to start moving around. So a lot of oral dysfunction comes from an improper swallow, and that is one of the biggest, that is in my opinion, the biggest end goal of myofunctional therapy. Because again, you're going to do this thousands and thousands of times a day automatically, and then you are continuing to essentially do your therapy for the rest of your life. So sometimes it seems like a big investment up front, a big commitment. We're spending money on this. You're investing in yourself. You're investing your time and energy to be able to learn these new functions. So in the grand scheme of your life, the amount of time we spend in myofunctional therapy and the investment that you make in myofunctional therapy is a drop in the bucket compared to what you're going to save over your lifetime of replacing broken teeth from clenching and grinding excessively and needing crowns and root canals and implants. And then, we keep the muscles in the throat strong. So you're really less likely to have trouble with sleep as you get older. Your chances of sleep apnea start to reduce. So the long-term benefit is immeasurable. It is just immeasurable when you stack up all of the potential costs in your lifetime that insurance doesn't help you with crowns and root canals and dental work and broken teeth and time missed from work and wasting vacation days and snoring and aggravating everyone in the family. So it's not just a monetary thing, it's a quality of life thing as well. It's just, you really cannot put a price tag on the benefits that you are going to get from myofunctional therapy. I've been doing this now for over 3 years. And in that time, I've had the absolute pleasure of being able to work with many, many different mentors and with different therapists all over the country. And through that experience, I have probably seen now hundreds of patients. And not once have I encountered a person who says, yeah, this was a waste of time. I wish I didn't do it. Every single person says, I wish I knew about this sooner. Where were you 20 years ago? Why did no one tell me about this before? I wish I did this earlier, and I'm going to tell everyone I know about it because it has changed my life. That is pretty much a summary of what every single person says, regardless of your symptoms being revolved around sleeping or snoring or clenching and grinding the teeth or bedwetting and issues in children. The answers are the same. It's life-changing. So I'm going to end it there because that really is the end. Time, money investment for life-changing benefits that are going to be hard to undo because you know what? You just made new nerve paths to your muscles and now they know what to do and they're going to do them like a boss every single time. Thanks for joining us for this episode. If you have any questions about myofunctional therapy, let's schedule a tell me more about this discovery call. And you can find that link to schedule on my website, myofunctionalpathways.com. Find the schedule button, and I can't wait to talk to you and let you know more about how this will change your life. Thanks again. Catch you next time.
Now for the fine print. The information presented in this podcast is for educational purposes only and should not be taken as medical advice. We recommend consulting with a qualified healthcare professional for any questions or concerns you may have regarding your specific health condition.